Hello, I'm Kaylee Noggle, the newly appointed Commissioner of the Department of Community Health. I'll start by saying that I appreciate you, our retired teachers, public school and state employees, and the service you have provided to so many Georgians over the years. On behalf of the department, it's my pleasure to introduce the State Health Benefit Plan's 2021 Retiree Option Change Period for the 2022 plan year. SHBP will continue to provide you with the same high-quality Medicare Advantage plan designs that we offered in plan year 2021 from Anthem Blue Cross and Blue Shield and UnitedHealthcare. In addition, I'm pleased to report that for this plan year, we are also able to hold premium rates flat with no increases. You can make elections during the retiree option change period either online or by calling SHBP Member Services at 800-610-1863. More information can be found at SHBP's website under the Retiree Option Change Period tab. Our team will also provide further details later in this presentation. Due to the COVID-19 pandemic, we'll continue with an entirely virtual format for our retiree educational sessions this year. We're grateful for the work that our SHBP team and vendors have done to make this process as smooth as possible and to provide answers to the questions you may have. I understand that you have important decisions to make for yourself and your family members, so I'd encourage you to use these resources to choose the plan that's right for you. The mission of the department is to provide access to affordable, quality health care to Georgians through effective planning, purchasing, and oversight. As Commissioner, I look forward to the opportunity to serving you as we continually strive to shape the future of a healthy Georgia. Before I close, I'd like to acknowledge the work and service of Anthem and UnitedHealthcare and our outstanding healthcare professionals who continue to demonstrate their commitment to a healthy Georgia during the ongoing pandemic. Again, thank you for your dedicated service to the state of Georgia. I'll now turn our presentation over to the SHBP team so they can talk through more details about the benefits and services available to you through our Medicare Advantage plan options.
I'm Louis Amos, the new Executive Director of the State Health Benefit Plan. The State Health Benefit Plan, along with our third-party administrators, Anthem and UnitedHealthcare, welcome you to today's presentation and are happy to share with you about your Medicare Advantage plan option. Our presentation this year is more streamlined and focused on our SHBP retirees enrolled in the Medicare Advantage plan options. For those of you who are retired and under age 65, are actively working and age 65 or older, not yet eligible for Medicare, please go to www.shbp.georgia.gov, where you will find resources geared towards our active members and retirees under age 65. The agenda provides a look at the topics we will cover today. We will cover the 2021 Retiree Option Change Period dates and important information, your 2022 Medicare Advantage plan options, Medicare Advantage resources, and frequently asked questions. I'm now going to turn our presentation over to the team so that they can talk through more details about the benefits and services they provide through our Medicare Advantage plan options.
This year, our annual Retiree Option Change Period begins on October 18th and runs through November 5th, 2021. The enrollment portal will be open from 12 a.m. Eastern Time on October 18th and will close at 11:59 p.m. Eastern Time on November 5th. Retirees can make their benefit election at myshbpga.adp.com or contact SHBP Member Services at 800-610-1863. During ROCP, SHBP Member Services hours have been extended. The extended hours are 8:30 a.m. to 7:30 p.m. Eastern Time, Monday through Friday. The Retiree Decision Guide is available on the SHBP website at www.shbp.georgia.gov. The Retiree Decision Guide contains important information about benefit changes for 2022 and outlines the steps retirees need to take during the Retiree Option Change Period to make their election. Retiree Decision Guide kits were mailed by the 1st of October. If you did not receive your kit, please log into the SHBP enrollment portal or contact SHBP Member Services to confirm SHBP has your correct mailing address. The 2022 retiree rates were included in your Retiree Decision Guide Kit mailing and can also be found on the SHBP website at www.shbp.georgia.gov/member-rates/retiree-rates. You may make your elections either online in the SHBP enrollment portal at myshbpga.adp.com or by contacting SHBP Member Services at 800-610-1863. You may go online as many times as you like, but the last election confirmed at the time the retiree option change period closes will be your election for the 2022 plan year. You should print and keep a copy of the confirmation page, which will include a confirmation number. If you cannot print, be sure to write down your confirmation number. This number is proof of the election you made should there be a discrepancy between the State Health Benefit Plan, or SHBP records, and your election. 2 to 3 weeks after the retiree option change period closes, you will also receive a confirmation statement from SHBP via mail if you have a valid address on file. Note, even if you made no changes to your elections, you will still receive a confirmation statement via mail. In order to save time, it is important that you update your password before the retiree option change period begins. Your password expires every 45 days. Log in to the SHBP enrollment portal now using your current password. If it has been over 45 days since the last time you logged in, you will be prompted to create a new password. If you do not know your current username or password, click Forgot User ID or Forgot Password from the enrollment portal login page. Please read all of the plan documents carefully, including the SHBP Eligibility and Enrollment Provisions document and the Evidence of Coverage, or EOC document, and other information posted on SHBP's website, www.shbp.georgia.gov, and take the required actions. It is important to keep your address current with SHBP. Please be sure to update any changes to your address as needed. You can make corrections anytime during the year, either online or by calling SHBP Member Services at 800-610-1863. After the retiree option change period closes, please verify with your state retirement system that the premium deduction amounts from your annuity check are correct and are being deducted and submitted to SHBP monthly. Notify SHBP within 31 days when you have a change in your covered spouse or dependent child. For most qualifying events, you must notify SHBP within 31 days of the event by logging into the SHBP enrollment portal or contacting SHBP Member Services at 800-610-1863 to declare the event. Continue to pay your Medicare Part B premium to the Social Security Administration if you are enrolled in an SHBP Medicare Advantage MA plan option. Do not enroll in a third-party, non-SHBP Medicare Advantage plan, Medicare Part D plan, or Medicare Supplement, or you will lose eligibility for SHBP Medicare Advantage coverage and be automatically enrolled in an unsubsidized active commercial plan option. As a retiree, during the retiree option change period, which is from October 18th through November 5th, you may change to any plan option and/or vendor for which you are eligible. However, you cannot add dependents to your coverage. You may drop covered dependents from coverage. However, it is important to note that since you are retired, you cannot add those dependents back. If you wish to discontinue SHBP coverage for the upcoming plan year, you may opt out of coverage. However, You will no longer be eligible for SHBP coverage unless you return to work with an SHBP employing entity in a benefits-eligible position. Retirees who do not make an election during the retiree option change period will be defaulted to the same vendor and plan option in 2022. For 2022, the Medicare Advantage plan options will remain the same as for 2021. The Medicare Advantage plan options are Anthem Blue Cross and Blue Shield, Anthem, MA Standard. Anthem Blue Cross and Blue Shield, Anthem, MA Premium. UnitedHealthcare, MA Standard. UnitedHealthcare, MA Premium. We will review the rates for these plan options later in the presentation. How do Medicare Advantage plans work? CMS requires a physical street address and Medicare number before approving MA coverage. Once approved, CMS will notify the state health benefit plan of the effective date of your coverage. You will receive a new insurance card from Anthem or UnitedHealthcare to use in place of your Medicare card when receiving health services. Enrollment in the MA PPO plan options is subject to CMS approval and is prospective. Retrospective enrollment is not allowed. You can use any doctor or hospital in the country as long as they participate in Medicare and accept the MA plans. You do not have to select a primary care physician or obtain a referral to see a specialist. Copays apply toward the out-of-pocket maximum, except for prescription drugs. There is no difference in your copay or co-insurance levels if you see providers who are in-network or if you see providers who are out-of-network. Now, let's take a closer look at some of the more common benefits of the standard and premium plans for 2022. There are no changes to your plan deductible and annual out-of-pocket maximums for 2022. Your copays and coinsurance for doctor's office visits, inpatient hospitalization, outpatient surgery, lab services, and emergency care also remain the same for 2022. The plan options between Anthem and UnitedHealthcare are identical. Let's also take a look at your prescription drug coverage with the standard and premium plans. The table shows what you will pay for a 1-month supply at a retail pharmacy. Costs for a 90-day supply via retail and mail order are available in your plan documents and retiree decision guide. Select generic drugs are available at a $0 copayment. You will be able to find a list of these drugs in the additional drug list that is part of the plan materials you will receive from both Anthem Blue Cross and Blue Shield and UnitedHealthcare. While the copayment amounts are not changing for 2022, you may want to check to see if the medications you are taking have changed tiers for 2022 with each vendor. Now, let's take a few moments to learn about the different programs and ways to save with Anthem and UnitedHealthcare. Anthem Blue Cross and Blue Shield wants to help keep you healthy by providing these programs, services, and ways to save. House Calls, which is designed to support and complement your regular doctor's care through an in-home clinical visit with a licensed healthcare practitioner. Live Health Online, where you can visit with a board-certified doctor virtually 24/7 from the comfort of your own home. 24/7 Nurse Line, where registered nurses are available anytime, day or night, to answer your health-related questions. Silver Sneakers Fitness Program, which gives you free membership to participating gyms and fitness centers. Our Compassionate Support Program, which provides access to thoughtful, compassionate support by highly trained specialists at no additional cost to members who qualify based on their health needs. These specialists help to improve communication among members, family, and providers to empower members to fulfill their personal wishes in their end-of-life decision-making. The Medicare Community Support Program, which is an outbound telephonic program that identifies needs, leverages resources, and coordinates services for retirees. The Healthy Meals Program, which provides nutritious meals to members upon discharge of an inpatient stay or in support of improving health for those who meet certain criteria. The Healthy Pantry Program, which provides nutritional guidance and monthly home delivery of non-perishable pantry items. The Special Offers Program, which offers discounts on health products and services, including hearing aids, glasses, and more. A $0 copay for certain services, such as preventive care screenings, online visits with a board-certified doctor or licensed therapist with Live Health Online, select generic drugs, and more. Access to 28,000 preferred pharmacies where you can get lower copays on brand and generic drugs. An extra covered drug list that covers many drugs not normally covered under a Part D plan. Anthem also offers special programs for members with chronic or complex health needs. UnitedHealthcare Medicare Advantage plans offer SHBP retirees exclusive programs, services, and ways to save, including new for 2022, Healthy at Home is designed to help you safely transition back home after being discharged from a hospital or skilled nursing facility. You can receive 2 meals a day for 2 weeks and 12 one-way rides to or from medically related appointments and pharmacies for up to 30 days when referred by a UnitedHealthcare advocate. The in-home personal care benefit includes up to 6 hours of personal care post-discharge, such as grocery shopping, meal preparation, and light housekeeping. Rally coaching programs where you will have access to unique programs designed to promote health and wellness, including weight loss, diabetes prevention, wellness coaching, and smoking cessation. UnitedHealthcare House Calls offer an annual wellness visit from a licensed healthcare practitioner in the comfort of your own home. Designed to complement your physician's care, they will review your medical history and current medications and talk to you about any health concerns you may have. Afterwards, they will send a copy of your summary to your PCP. UnitedHealthcare completed almost 25,000 house calls for SHBP retirees this year alone, and members who received a house call had a 98% satisfaction rate. Renew by UnitedHealthcare is a health and wellness experience for inspiring lifestyle tips, learning activities, videos, recipes, interactive health tools, and more, all designed to help you live your best life. Plus, you can earn rewards for preventive screenings, such as your annual wellness visit. With UnitedHealthcare Hearing, you have access to hundreds of name brand and private labeled hearing aids at significant savings that can make your hearing aid allowance stretch a lot further. Virtual doctor visits and behavioral health visits allows you to video chat with a doctor or behavioral health specialist from your computer, tablet, or smartphone, anytime, day or night. Doctors on Demand and American Well, Amwell, are part of the UnitedHealthcare Provider Network, bringing you this innovative service. 24-hour telephonic nurse support is available anytime, day or night, where a registered nurse can answer your health-related questions. Silver Sneakers provides a membership to thousands of fitness locations and exercise classes. UnitedHealthcare also offers special programs to help members who are living with chronic disease, like diabetes or heart disease. You are able to get personal attention, and your doctors get up-to-date information to help them make decisions. There is a $0 copay for certain services, including an annual wellness visit and other preventive care visits. An annual wellness visit with your doctor is one of the best ways to stay on top of your health. There is also a $0 copay on select generic drugs at a network retail pharmacy or Optum Rx mail service pharmacy, along with the convenience of filling a 90-day supply at either a retail pharmacy or mail service pharmacy. You can learn about these programs and more by visiting the Virtual Education Center at www.uhcvirtualretiree.com/SHBP. The Virtual Education Center was created to make caring for yourself easier, so UnitedHealthcare brought its resources together in one place at your fingertips, whenever and wherever you need it. Your monthly plan premium will be $146.15 for the Anthem Blue Cross and Blue Shield Standard Plan and $0 for the UnitedHealthcare Standard Plan. Your monthly premium will be $298.68 for the Anthem Blue Cross and Blue Shield Premium Plan and $148.22 for the UnitedHealthcare Premium Plan. Please note, these monthly premiums do not account for any amounts charged according to the annuitant subsidy policy. If you have any questions regarding the rate you will pay, review the detailed information regarding the basic or years of service policy that applies to you and the corresponding rate calculator at the SHBP website www.sHBP.georgia.gov/member-rates/retiree-rates. Now, we would like to review some Medicare Advantage resources that are available to SHBP members. If you would like to find out more about SHBP retirement eligibility and requirements, take advantage of REST. The Retiree Educational Sessions and Training, also known as REST, was created by SHBP to have an educational program specifically for our retirees and those pre-retirees who continue coverage with SHBP after transitioning from employment with an SHBP employing entity. Visit the REST section of the SHBP website at www.shbp.georgia.gov/REST. To find out more information about plan options, rates, direct pay, turning age 65, eligibility, notifications, and processes for SHBP Medicare Advantage plans, please visit the retiree section of the SHBP website at www.shbp.georgia.gov/members/retirees. One new initiative being highlighted for the 2021 Retiree Option Change Period is the Skip the Phones campaign. As part of our Skip the Phones campaign, we are reminding SHBP Medicare Advantage members that this year's Retiree Option Change Period is a passive enrollment period, which means the vendors and plan options offered by SHBP will remain the same as last year. So retirees currently enrolled in coverage are not required to make an election unless they want to make changes. Retirees currently enrolled in coverage who take no action will simply roll over to the same plan option they are currently enrolled in. So, if you're happy with your current plan option and have no changes, you do not have to take any action for this year's Retiree Option Change Period. For more information on the Skip the Phones campaign, visit the REST section of the SHBP website at www.shbp.georgia.gov/REST. As a reminder, if you are currently enrolled in commercial, active, non-MA plan option with Anthem or UnitedHealthcare, remember to redeem any points before transferring into a Medicare Advantage plan option. Points are not automatically redeemed and transferred for Medicare Advantage members. When you redeem your points for well-being incentive credits prior to moving to a Medicare Advantage plan option and have a balance of 100 or more credits after the claim's run-out period, which is 6 months, the credits will Remain with the active non-Medicare Advantage plan if you have a spouse and/or dependent or dependents who is still on that plan. If there are any credits remaining, once the last active member moves to Medicare Advantage, the credits will follow that member. Or, the credits will move over to your Medicare Advantage plan option in a retiree reimbursement account if there are no members left on the active non-Medicare Advantage plan. Once you move over to a Medicare Advantage plan option, you are no longer eligible to earn points with ShareCare. As a final reminder, the retiree option change period dates are October 18th, 2021 at 12 a.m. Eastern Time through November 5th, 2021 at 11:59 p.m. Eastern Time. During that time, we encourage you to take the time to verify your plan election. It is also a great time to review information like address, phone number, and dependent information to make sure it's correct and up to date. If you have any questions about the Anthem Blue Cross and Blue Shield Group Medicare Advantage PPO plans, please give Anthem Blue Cross and Blue Shield a call at 855-322-7062 from 8 a.m. to 8 p.m. Eastern Time, Monday through Friday. If you have any questions about the UnitedHealthcare Group Medicare Advantage PPO plans, please give UnitedHealthcare a call at 877-246-4190 from 8 a.m. to 8 p.m. local time, Monday through Friday. Lastly, if you have questions or need additional information regarding the retiree option change period, please contact SHBP Member Services at 800-610-1863, where you can take advantage of their extended hours for open enrollment Monday through Friday from 8:30 a.m. to 7:30 p.m. Eastern Time, or visit the enrollment website at www.myshbpga.adp.com. We will take a few minutes to highlight some of the frequently asked questions that we often receive from retirees. What vision and dental coverage is there on the Medicare Advantage plan options? The vision coverage includes one routine eye exam every 12 months. For the standard plan option, a routine eye exam is a $30 copay, and for the premium plan option, a routine eye exam is a $25 copay. The plan also pays up to a $125 combined allowance for eyewear and contact lenses every 24 months. The Medicare Advantage plan options do not cover routine dental care such as cleanings and fillings. Non-routine dental care that is Medicare covered, i.e. broken jaw, is subject to a $25 copay for physician visits on the standard plan option and a $15 copay for physician visits on the premium plan option. Note, for those who have vision and/or dental with Georgia Breeze, please call them at 877-342-7339 with questions about carrying your vision or dental plan into retirement with you. Can I continue to participate in the Pharmacy Copay Co-Insurance Waiver Program? The Pharmacy Copay Co-Insurance Waiver Program is an SHBP program for members and their covered dependents that are enrolled in one of the Anthem or UnitedHealthcare commercial, non-MA plan options. When you move to an SHBP Medicare Advantage plan option, you are no longer eligible for this program. However, there are certain select generic drugs available at a $0 copay with Anthem and UnitedHealthcare Medicare Advantage plan options. What is a split coverage household? When at least one member of your family has a Medicare Advantage plan option and one or more state health benefit plan, SHBP covered family members, receive coverage under an SHBP commercial plan option, you have a split plan option. For example, Steve is retired with SHBP and just turned 65 years old, making him Medicare eligible. His spouse, Ann, is under 65. Steve will choose a Medicare Advantage plan option while Ann will stay with her commercial plan option. If you have a split policy, you are not required to have the same insurance carrier. The individual on Medicare Advantage can have one carrier, while those on the commercial plan option can have a different carrier. In the above example, Steve decides to enroll in the SHBP UnitedHealthcare Medicare Advantage Standard Plan option, and he enrolls Ann in the SHBP Anthem HMO plan option. Once all members on the policy move to Medicare Advantage, you must be on the same plan option with the same carrier. Example: in the above example, once Ann turns 65 years old, if she has provided her Medicare Part B to SHBP, she would be enrolled in the same plan option as Steve, the SHBP UnitedHealthcare Medicare Advantage plan option. Both the Anthem and UnitedHealthcare Medicare Advantage plan options offer coverage nationally throughout the United States and U.S. territories. With the Medicare Advantage plan options, you have the flexibility to see providers that are both inside and outside the plan's network. You can see any provider that accepts Medicare and the plan. If you travel outside of the country, emergency services are covered. You will need to pay up front for the services and submit a copy of the bill to the address on the back of your ID card for reimbursement. Both Anthem and UnitedHealthcare offer Silver Sneakers at no additional cost with their Medicare Advantage plan options. Silver Sneakers gives you access to gyms nationwide and also offers virtual classes and on-demand online workout videos. You are automatically signed up for Silver Sneakers under the Medicare Advantage plans with Anthem and UnitedHealthcare. If you switch plan options, your Silver Sneakers membership will move with you. If you can't find your 16-digit ID number, you can call Silver Sneakers customer service at 866-584-7389. This concludes our overview of your 2022 Medicare Advantage Plan year benefits. Thank you for attending, and we look forward to continuing to serve you.